Good morning, everyone. Before I start my presentation, I would like to say thank you for Ateneo University for inviting me. It's an important event, not just for the Philippines, but for Indonesia. So I'm coming from Indonesia, where both of the countries share the same concerns on how we deal and how we address drug problems. So it's an important event for me to learn from the other speakers as well. A little bit about my organizations. We are a legal aid organization providing free legal services for people who use drugs, among others, marginalized groups, based in Jakarta. We train drug users to be paralegals so they can help advocate their communities. We also represent people facing the death penalty or executions. I personally represented Rodrigo Gularte, a Brazilian national who had schizophrenia and bipolar disorder and was executed by Indonesia in April 2015. I also represented Humphrey Ejike Jefferson, a Nigerian national who was innocent and was executed by Indonesia in July 2016. And I also represented Mary Utami, the only Indonesian woman who was scheduled for executions in July but was reprieved at the last minute. I will start with legal framework in Indonesia because the way we deal with drug policies in Indonesia, the way we operate our so-called war on drugs or the punitive approaches is manifested in our law. The objective of the law clearly and explicitly says that we need to provide treatment for people who use drugs. But at the same time, we need to counter illicit drug trafficking. But interestingly, we don't differentiate between drug users and drug dealers. We criminalize drug use, drug possessions, drug dealings. So for example, if I'm a drug user and I get caught or arrested for drug dealing, police will charge me with drug dealing instead of drug use. As a result, I will end up in prisons and I will not get any treatment. The law also obligates drug users to report themselves to a so-called institutions of compulsory treatment. So the option for a drug user in Indonesia, there are two options. First, you have to report yourself to the institutions of public report, of compulsory report, and then you will get compulsory rehabilitations. Or otherwise, if you don't report yourself to this so-called institution of compulsory report, and if you get arrested, you will end up in jail. But in practice, both are the same because they don't get any treatment. The compulsory rehab is comprised of both medical and social rehabilitations. And this so-called institution of compulsory report is basically hospital, community health care center, and then also police and National Narcotics Board. So you would imagine a drug user wouldn't want to report themselves to the police, of course. And then there's an article in the Indonesian narcotics law, which is known as drug user article. That's the article of 127, which introduced rehabilitation verdict. So if a drug user gets arrested for drug using, he could get maximum 4 years imprisonment. The judges may send them to rehabilitation, but it's very unlikely. And of course, the narcotics law introduces death penalty for drug offenses. I have a special slide on death penalty. The Indonesian Supreme Court Circular Decree number 4, year 2010, was enacted because the intention is to divert drug users, those who get arrested, to get rehabilitations. So this document enlists a number of criteria, and criteria including threshold of drugs, certain drugs. So if a drug user gets arrested with these drugs, under the amount of this threshold, and they got arrested for drug using, and then they have medical record, and they are not involved in trafficking, they will, according to this document, the judge should send them to rehabilitation. But in practice, this is not an effective policy as well. This is a table, a pie chart about the total detainees and prisoners as of August 2016. And as you can see, we have more than 166% of capacity. And one of the causes is almost 50% are for drug offenses. And as you can see, and in some prisons, those drug offenders can more than 60% of the prison populations. As you can see, there are 61% of drug dealers and then 38% of drug users in prisons. But this numbers is problematic because the differentiation is based on the articles of 127 and non-127, the drug use article and the non-drug use article. And this doesn't count any drug users who get arrested for example, stealing or any other crimes they get imprisoned. And this also proves that there are still people who use drugs in prisons. And of course, when you imprison drug users, you will create market inside the prisons. In Indonesia, in the past some years, there's always drug dealing from inside prisons. And that's why the head of the National Narcotics Board said that we need to have piranhas, we need to have crocodiles around the prison, so then they cannot escape, so then there won't be drugs inside. But obviously, if you send drug users to prisons, you create the market inside the prisons, and you don't provide treatment for them. There's no treatment available inside prisons. And of course, it will bring negative impact to the general prison populations. So from a perspective of drug policy reform, dealing with drugs can help reduce these mass incarcerations that happens in, not just in Indonesia, but in Thailand, in Malaysia, and in the US. And who gets the rehabilitations? If you remember the threshold that I've mentioned earlier, so my organizations, we documented a number of court decisions in which those get arrested with under the threshold, but only 8% get rehabilitations. So even though we have the laws, we have the policy, we have the documents that mandates, that recommends judges to send drug users to prison, only 8% get rehabilitations. And from those charged with Article 127, the drug users article, only 27% get the rehabilitations. So this shows a high spirits of sending drug users to prisons with this whole punitive approaches. Now, when we talk about war on drugs, it's not just about the laws that creating this punitive environment, but the leaders also create this repressive environment as well. So we have the head of BNN, who is very much in favor of the war on drugs, the so-called repressive policies. The president, on the occasions of anti-drugs days in June 2016, he said that if the law permits, let's shoot them. Basically, more or less like Rodrigo Duterte. But the law prohibits that. And the head of parliament also said that drugs is one of the evil, the most problematic issues that we face in the nations, apart from terrorism and corruptions. And of course, the extreme measures of punitive actions in the context of drug policy in Indonesia is death penalty. 18 people have been executed so far within 18 months, and the justifications, and all for drug offenses. And the justification is that in Indonesia, we have this so-called tagline, drug emergency situations. So when President Jokowi was inaugurated in October 2014, in November 2014, in December 2014, he declared that Indonesia have 2015 drug emergency situations. So let's kill all death row convicts for drugs. I will reject all clemency submitted by these death row prisoners. So it obviously clearly violates the right to clemency because you have to individualize the clemency petitions. And I suppose why we came out with drug emergency situation is that because previously we came out with 2015 drug-free society, and it failed, of course. And then they need to have this kind of paradigm. So let's create these drug emergency situations. So the President Jokowi often cited the flow statistics that 30, 40 people die every day. And it flows because the methodology is questionable. Lots of prominent academics, both from Indonesia and abroad, have criticized the methodology that President Jokowi used to justify his drug emergency situations. In January, 6 people were executed. In April, 8 people. 1 person was reprieved, and I'm sure you all know this person, Mary Jane Veloso. In July, there were scheduled 14 people to be executed, but only 4 got executed. Is this working? So the head of BNN, Budi Waseso, quoted in the media, he said that there was an increase of drug use from 4.2 million of people in June 2015 to 5.9 people in November 2015. This was just after 2 rounds of executions in 2015. In 2014 to 2015, there was an increase of 13% of drug cases reported by the Coordinating Minister for Legal Affairs. The statistics that I show was just from the BNN. It does not include the statistic from the police. But when we go into the annual report of the BNN, the National Narcotics Board, every year from 2009 until 2015, the number of drug use, the number of drugs cases, the number of people arrested for drugs cases always increase. So it doesn't show any decrease. After years of punitive policies, we had executions in 2008 for drugs offenses as well. We had execution for drugs in 2013 as well. We had execution for drugs in 2015 and 2016 as well. And this clearly did not curb any drug offenses in Indonesia. So those are the legal and political environments. In terms of social campaigns and how we deal with drugs, it's always seen as evil. For more than 30 years, the Indonesian society, I think, have been brainwashed by this propaganda that drugs are evil, stay away from drug users. Parents will say, don't go to clubs, you will be involved in drug trafficking. Stay away from drugs. Oh, this guy is skinny, he's using drugs. Oh, that guy has red eyes, he's using drugs. Stay away from these guys, people. So those kind of, the way we deal with drugs. And these are just some of the posters that issued or produced by the National Narcotics Board. So you can see that there was a women with high school uniform dying, and there's a phrase, independent living or dying. And then on the left side, there's a forbid narkoba, haramkan narkoba, and the way they portray is with these mummies. And then there's this skeleton. So it's common that we, in social environment, the war on drugs demonize and stigmatize drug users. It portrays in negative. They don't show support to people who use drugs. And but in fact, there are a lot of people whose drugs are productive. They have a good life. They can be leaders in their communities. But there are people whose drugs who don't have access to treatment. Mostly they are poor, and they don't have any support from the family. If parents found out that their children are drug users, they probably expel them. they basically don't support people with drugs. So we need to have campaigns that destigmatize and humanize people who use drugs. Final words, war on drugs. The intention of war on drugs is solve the drug problem. But history in many countries shows that it's a war that we cannot and we will never win. Billions of dollars have been wasted for this. Prisons are full of people. It's intended to provide treatment, but it's not providing treatment to people with drugs. And there are always reasons for people using drugs, be it social, be it economic reasons. And a lot of them are poor, like in the Philippines, like Indonesia as well. The war on drugs actually targets the people, targets the most these people who suffer because of the failure of the countries to deal with the underlying factors of people using drugs, be it economic poverty, inequality, no employment, no social support. In Indonesian context, Indonesian failed to address poverty, to address why drugs keep coming into Indonesia, and they use that penalty as a shortcut to address this problem. On the other side, this group of people, poor people, low economic backgrounds, usually they are the majority of people who support, who endorse populist leaders like President Jokowi, like I understand President Duterte in the Philippines. So actually this policy targets these people where they need it the most, from the way you want to have this more economic-oriented people policy. So instead of trying to win the utopic and failed war, we need to stop the harm. And as this forum entitled, What Works, What Doesn't Work? What doesn't work, clearly, repressive and punitive approaches. What works is an approach that places respect for dignity for all at the heart of our policy, coupled with evidence-based public health responses in partnership with those affected the most, people who use drugs. We need to listen from them. We need to discuss with them how to deal with their addictions. In Indonesian, there is this phrase, we don't clean the dirty kitchen by burning the house. So what works? Harm reduction, it saves life. And we need to continue the discussions on an open and honest and transparent debate on our drug policies. Thank you.
Good morning, everyone. Thanks a lot for bringing me in this morning and bearing with me with joining you by video conference. It's a bit disorienting because I can't see you at all and I can't hear anything that's going on. But I'm just going to try to do the best I can and hope that you can catch what I'm saying, and I hope to be able to interact with you at some point. I'm sorry I wasn't able to catch in the presentations this morning, and so I missed out on what Senator Risa and what Ricky was saying, and I hope what I have to share with you doesn't overlap. But I'm going to be brief and kind of presenting to you at a general level, but maybe we can go into more specifics later. I have a slide presentation as well. But I think first I'll just introduce to you who we are. So I work for the International Drug Policy Consortium. And we're a global network of over 150 civil society organizations. And we advocate for evidence-based drug policies that achieve better outcomes for public health, human rights, human security, and development. And we advocate for those drug policies to be made in transparent and accountable ways that include the voices of civil society, and most importantly, the voices of those who are affected by drug policies. And one of those key groups are people who use drugs. And who am I? I'm Gloria. I'm an Australian. I'm a Chinese by way of background. I started my career first as a lawyer and then as a policy advisor on drug issues for the Australian government before moving overseas. And for the past 5 years, I've been working as a senior policy officer for the International Drug Policy Consortium, IDPC. I'm based in Bangkok in Thailand, and I lead on our Asia program of work. So just to the first slide on the outline, so what I had prepared for today was just to speak to you, just, I guess, in a really summary manner about global drug policy, a bit of an intro, and then going on to speak a bit more specifically about a major moment in terms of global drug policy that happened earlier this year in April. That's the UNGAS. It's an acronym for the UN General Assembly Special Session on, and this particular UNGAS was on the world drug problem. So go into a bit more about that. Before just trying to end on a bit of an outlook for the region, what it might look like in terms of drugs and drug policy, and in particular the prospects for a health-based approach. So just going into the next slide, so the global drug policy. So I think just to say from the outset that there are 3 international global treaties that govern the control of drugs, and they were agreed in 1961, 71, and 1988. And here, just to clarify that when I refer to drugs, I'm only referring to certain drugs. That is, those that are deemed necessary to be prohibited. And so it doesn't include alcohol and tobacco, for example. And in each of these treaties, the primary stated objective is to protect the health and the welfare of mankind, and to achieve that by limiting the use and the supply of drugs to medical and scientific purposes only, so that the use of drugs for recreational purposes, for example, would not be permitted under these treaties. Now, over the past 5 decades, most countries around the world have come to adopt drug policies that have an overwhelming focus on punishment and on using law enforcement and criminal justice measures to eradicate drugs. So that is by seizing drugs and arresting people who produce, traffic, and deal drugs, and even those who use drugs or are caught in possession of drugs for personal use. And the focus of many countries' drug policies became on eliminating the supply and the demand for drugs. And so in 1998, there was an UNGAS. The last UNGAS before the one this year was held in 1998. And the slogan for that was, "A drug-free world, we can do it." So you can see that just an image on the slide for the UNGAS that year. So I'll talk more about the latest UNGAS a bit later. Now, striving to achieve a drug-free world may sound like a noble and inspiring goal, but it is completely unachievable while being incredibly damaging at the same time. And there are several reasons for this, and I'll mention some just briefly now and then go into a bit more details later. And so we're now on the slide, headline, "The War on Drugs." So one reason that trying to achieve a drug-free world is damaging is that many types of drugs have important functions for medical purposes. They have essential functions for protecting and advancing human health. And we see that in morphine in particular, which is made from opium poppy, and cannabis, which more and more research coming out showing the medical benefits of using cannabis for particular health purposes. And another reason is that there will always be people who choose to use various substances for a range of reasons, for pleasure, for fun, to escape from traumatic circumstances, and to cope under tough living or working conditions. So we see in many parts of the world, particularly in Southeast Asia, the use of drugs, methamphetamine, for example, for people to be able to work for long hours, people who need to do long distance driving or construction work, for example. And importantly, adopting a sole focus on eliminating drugs has resulted in the use of excessively punitive measures against people who have anything to do with the supply and the use of drugs. So the next slide, when we're looking closer a bit at Asia. So when we look at Asia, we see some of the worst extremes in drug policies around the world. Drugs are often portrayed as a threat to state security and a moral hazard that must be eliminated. and thereby justifying the use of incredibly harsh punishment. And so it is in this region that we see measures for people caught using drugs, such as on the next slide, listed them under addicted to punishment. Here in this region, we see forced urine testing. We see compulsory registration that's required of people who use drugs with security agencies, which could then lead to ongoing surveillance and random interrogations by police. We see corporal punishment, such as caning, flogging, or whipping in Singapore, Malaysia, Brunei, Pakistan, and the Maldives. We see forced rehabilitation that's used in compulsory detention centers, where a person caught using drugs can be detained for up to 3 years, such as in China. We see criminalization and imprisonment, and more recently we've seen in the Philippines extrajudicial killing. And for drug supply activities such as the trafficking and the production of drugs, we see long prison sentences, and even the death penalty can be imposed as a mandatory sentence. So here I just showed the next slide just of a report. Harm Reduction International is it's an international NGO. They do regular reports around the use of the death penalty for drug offences. And we see the death penalty used as a mandatory sentence in Iran, Malaysia, and Singapore for the possession of small amounts of drugs. And I'm sure that Ricky went into detail on this in the case of Indonesia. But the death penalty for drug offences goes against international law. As the International Covenant on Civil and Political Rights say, it may only apply for the most serious crimes. And that's interpreted by the UN to essentially mean intentional killing. And the purpose of imposing such harsh punishment is to deter people from engaging in the drug trade, thereby reducing and then eliminating the supply and the demand for drugs. But that hasn't happened. So in Asia, based on available data of drug seizures from the UNODC, we see the next slide. We see that drug markets have been expanding for at least the past few years. We see this slide is on data from the UNODC on the rates of illicit crop cultivation in ASEAN. But and this happens primarily in Myanmar, in Laos, and in Thailand. The next slide. We see rates of seizures of opium and heroin growing. And here, this is taken from the World Drug Report. You can see the red balls show where there are increasing trends. And here in relation to heroin and methamphetamine. And the next slide, we see at least in this region, it's ATS or amphetamine-type stimulants, which include methamphetamine, that dominate the market in this region. And actually, the regions of East and Southeast Asia and Oceania combined are estimated to have the largest market for ATS users in the world. Australia, the country where I'm from, also has one of the highest rates, I think if not the highest rate of use of ecstasy in the world. Now, some of the impacts of having a war on drugs or a tough on drugs approach to drug policy that we see in the region, we certainly see negative consequences for public health, such as high rates of HIV and hepatitis C prevalence amongst people who inject drugs. And so the next slide, you see this data is taken, it's the latest data that's captured by UNAIDS. So it's reported, you can find this on the AIDS Data Hub. And here we see Philippines having the highest rate of HIV amongst people who inject drugs. And this is based on data from Cebu and Mandawi only. Sorry, I know I'm not pronouncing that properly. We also know that we see that there's high rates of imprisonment and prison overcrowding. So that's the next slide. When we see some prison data in ASEAN that we put together based on data from UNODC in the past year. And you see here, and we see the Philippines actually featuring there as well, but Thailand, where I am now, the rates of people in prison for drug offences is incredibly high. And for women, this has been highlighted as a concern by the government here. Women, they make up a minority of the prison population here, but a much higher rate of women who are in prison here are held for drug offences, 80% or more. So some of the impacts of having a war on drugs, actually before I wanted to go on to the next slide, and this is on methamphetamine-related arrests in ASEAN. And you see just increasing rates of drug-related arrests again, but here this was data that was kindly passed on from the UNODC, and in this particular one it doesn't include the Philippines. It includes only a few countries in ASEAN, as well as South Korea and Japan. But when we look at this impact of having a war on drugs or a tough on drugs approach to drug policy in the region and in the world, what has that achieved for us? Has that helped us in achieving the stated goals of reducing or even eliminating supply and demand? If we look at the US, for example, that's where the then President Richard Nixon launched the global war on drugs in 1971, and then went on to inspire other similar approaches around the world. You can see the rapid increase in drug control spending from that year. From 1971 onwards, the rate of drug control spending has just gone up really rapidly. But you see at the same time, the rate of drug addiction has just gone slightly up and down, but it just really hasn't changed that much. And particularly in the proportion to the massive scale up of funding that's put for the war on drugs in the US, just almost, you can say, almost probably no impact on the rate of drug addiction in the US. In the next slide, we see that despite an increase in seizures over the past 2 decades, the price of drugs has dropped and the purity has increased. This suggests that the supply of drugs is increasing. It's cheaper, so it's easier to get drugs, and those drugs can have higher risk for health because the rate of purity is increasing. And the next slide, we see a prediction from the UNODC, this is in their World Drug Report in 2012, where they predicted that the numbers of people who use drugs will continue to increase over future decades. So not only are we not succeeding in reducing the use and the supply of drugs, our current approaches to drug policy have led to a range of unintended consequences. And this was a phrase that was coined by the executive director of the UNODC at the time in 2008 by Antonio Maria Costa. So he listed these unintended consequences of kind of tough on drugs approaches. This is the slide that's headed up unintended consequences. We see a $360 billion criminal black market, a hugely profitable trade that's fueled by powerful organized criminal networks, some who operate with extreme violence, as we've seen in parts of Latin America. We see policy displacement. So whereas much greater amounts are invested in criminal justice instead of health, we see geographical displacement. This is sometimes referred to as a balloon effect. So where law enforcement targeting of one area, it might be able to reduce or eliminate drugs in one particular area, but it simply shifts those drugs, that drug-related activity, to another area. It doesn't actually completely eradicate those activities. We see substance displacement, where law enforcement targeting of one type of drug only shifts people to use another type of drug. And we saw this actually quite clearly, and there's research done on this by the Transnational Institute in the area around the Golden Triangle in particular, how when we crack down on heroin, the drug-related activities are simply shifted to methamphetamine. And so you saw the clear rise in the methamphetamine markets over the past few decades. And lastly, we see a high stigma against people who use drugs, because drug use is seen as something that cannot be tolerated, it must be punished and treated as a crime, and this in turn leads to negative health consequences again. Next slide, if we go on to looking at public health impacts on a global scale, hundreds of millions of people who use drugs, up to 22 million people who inject drugs, over 13% of them who are living with HIV now. More than half of people who inject drugs have hepatitis C. We see, again, widespread stigma and discrimination. We see underfunded health responses. And this is a huge tragedy. Because it basically means that even where there are people who want to get help, and maybe they want to stop using drugs, and to do something to improve their health and those around them, they can't find that help because it's not there. We haven't invested in it. We see a lack of access to essential medicines. So you see over 80% of people in the world have low or non-existent access to essential medicines, meaning that there are many people in the world who die in pain. And next, we see numerous human rights impacts that are negative. We have disproportionate penalties and sentencing. We mentioned before mandatory sentences for the mandatory death penalty sentences for drug trafficking offences that don't consider the circumstances of the individual. We see a lack of due process and fair trial. Many people who are arrested for drug offences are poor and vulnerable, and they can't afford legal representation. That often leads to, again, part of that disproportionate sentencing effect. Use of the death penalty, extrajudicial killings, even where countries don't have the death penalty. We see torture that is carried out in the name of rehabilitation to stop people from using drugs. We see police brutality against, and that's where the poor, the vulnerable, and the marginalised suffer the most. And we see violations of the cultural and traditional rights of Indigenous groups. And here in particular, we're thinking of groups where use of certain drugs that are deemed prohibited under the drug control treaties, those who use it even for their traditional or religious practices are no longer able to use it, or they're told that they're no longer able to use it. And last but not least, the next slide, we see disproportionately high rates of incarceration for people who committed a drug offence. And many of those are people who have been held for a low-level, non-violent offence. And according to UN estimates, 1 in 5 people currently in prison around the world are there because of a drug offence, and more than 80% of them are in prison for possession offences alone. So this is possession. It's not even trafficking or doing anything violent or necessarily hurting other people. So when we go on, we see the UNGAS. The UNGAS that was held in April this year was the first of its kind in almost 2 decades. So we mentioned before, the one before that was in 1998. It was actually scheduled to be held 20 years after that. So this UNGAS that was held this year was supposed to be held in 2019. But because of the levels of extreme violence relating to the growth of organised criminal activity and other negative consequences of prohibitionist drug policies I mentioned before, the leaders of Mexico, Guatemala, and Colombia called on the UN General Assembly to bring forward the UNGAS to 2016. From 2019 to 2016, they saw an urgent need to rethink the way we approach global drug policy. And in a joint statement released in 2012, this is what the head of state, this is what Colombia said to the UN General Assembly. That's the next slide. They said, revising the approach on drugs maintained so far by the international community can no longer be postponed. And the UN needs to exercise leadership to conduct an in-depth review, analysing all available options, including regulatory or market measures, in order to establish a new paradigm that would impede the flow of resources to organised crime groups. Now here I wanted to go just to take a bit of a closer look at Colombia. I'm not an expert at Colombia, but I mean, it's fascinating to see why a head of state of Colombia, well, as well as Mexico and Guatemala, why they felt that this was such an important issue, why they felt there was such an urgent need to reconsider our approach to drug policy. And I thought it was useful for both myself and to share with you to have a look a bit more at the case of Colombia. Now the next slide, we see Plan Colombia. So I'm just looking at just more recently, in the past decade or so, how they've approached drug policies and how that's turned out for them. Now, after militarizing their response to fight against drug production and trafficking networks, so they brought in their military and they got a lot of assistance, a lot of financial aid and so on from the US government to do this. And they did this as part of a policy known as Plan Colombia. It spanned 15 years starting in 2000. And the main target was cocaine. Colombia was the world's top producer of cocaine. They produce coca, the coca crops, which are then used to process into cocaine. But we see over these past 15 years that the trends in cocaine and coca production simply fluctuated. It shifted to Peru for a while. So in 2013, Peru became the world's top producer of cocaine. But then in 2014, it just shifted back to Colombia. And again, almost towards the end of Plan Colombia, after almost 15 years, Colombia again becomes the world's top producer of coca and cocaine. But over this same period, we see over 3,000 civilians who were killed in cases that are still being investigated. I understand that a number of these cases were perpetrated by the military. They had tremendous pressure to deliver and to show that they were meeting targets in fighting this war on drugs against groups. And so they killed civilians in the process, and the allegation is that they dressed up those civilians as in paramilitary outfits to make it look as if those were the people that they're supposed to be fighting. So we see a lot of civilians in the crossfire. We see communities that have been displaced, disenfranchised, and impoverished because of aerial spraying programs that were done to forcefully eradicate coca crops. Now, between 2000 and 2014, the number of people in prison for drug offences in Colombia also grew by almost 270%. And this was much higher than the increase of the total prison population. We see that in 2014, 20% of the people incarcerated in Colombia were there for drug crimes, an increase from 12% in 2000. Now, at the UNGAS, the Colombian president, the next slide, please. Oh, sorry, I forgot to do this. Were the rates of homicide in Colombia. The next slide. By the way, these rates of homicide were presented in an article. There was a special research article that was published in The Lancet. So they brought together a big group of scientists, actually, to do an assessment on the effectiveness and the consequences of global approaches to drug policy. And this was released around the time of the UNGAS this year. So it's a really great article, and if you can't find it, you can let me know. It's available online for free. The next slide, please. Now, around the time of UNGAS, the Colombian president, Santos, he said that if something is not working for more than 40 years, logic and common sense tell you it must be changed. And he called for a more effective, lasting, and human solution to the drug problem. And he proposed 4 particular issues that he said needed urgent attention if progress is to be made. That's the next slide. Firstly, we need to frame drug policy in a context of human rights, which stops stigmatizing people who use drugs and stops forcing them into treatment, as well as abolishing the death penalty for drug-related offences. Second, he called for enough flexibility for governments to be allowed to adopt national policies that take into account local realities and challenges. And for example, to allow controlled experiments in regulating drug markets. And he asked for the UN to monitor these experiments and to include them for discussion in the next major UN meeting on drugs that's expected in 2019 or 2020. Thirdly, he called for a transition from a purely repressive response towards a more comprehensive approach that comprises a public health framework to the treatment of drug consumption, focusing on prevention, rehabilitation, and resocialization of people who use drugs. He also called, and because the issue of farmers who cultivate crops that are deemed illicit for subsistence purposes, he was particularly concerned with them. And he called for those communities of small growers of crops that are deemed illicit to be provided with social and economic alternatives to create the necessary conditions to help bring them back into legal markets. And lastly, he did call for governments to persist in combating transnational organized crime. So that's crime at the high level end of the supply chain. So not to target those low level players, whether they're engaged in use or supply, but target those who cause the most harm. And he would categorize or identify those people as those engaged in transnational organized crime. He called on countries to increase their efforts and to strengthen international cooperation. And I think this is probably also relevant when you think of the balloon effect. And in Colombia, they definitely saw that when they cracked down on coca and cocaine in one part, it just shifted towards another country. And so he identified international cooperation as one really important element. So after all this, there was reason to hope that almost 4 years after that initial call by Colombia, Mexico, and Guatemala to call for an urgent rethink, there was reason to hope that we could see a significant shift in an internationally agreed approach to drugs. In addition to that, we have seen over the past few years unprecedented numbers of governments voicing their displeasure with the international drug control system. we have seen genuine reforms taking place on the ground. So you see changes in the way that governments have approached drug policy. You see, for example, the establishment of legally regulated markets for cannabis in Uruguay and in a number of US states, including Washington and Colorado, and more expected to follow suit. And Canada recently, also this year, announcing plans to establish legal regulation of cannabis starting next year. And all these are actually in violation of the international drug treaties, because as I mentioned earlier, the drug treaties only permit the use of controlled drugs for medical scientific purposes, not for recreational purposes. But these kind of shifts in drug policies are another indicator of the need to rethink our global control framework for drugs. And the principle of harm reduction, that is the idea of reducing the harms relating to drug use and even supply, rather than only focusing on eliminating the supply and the use of drugs, this concept of harm reduction is becoming more widely accepted than ever before, and the coverage of interventions for harm reduction has been growing. Now, a further shift in terms of the backdrop to the UNGAS is that of the US, the country that kind of started this war on drugs. And they've long been the global enforcer of repressive drug control measures. They're increasingly taking on the language of public health, and they've moved to address the disproportionate sentences for drug offences at the federal level, recognizing that they cannot incarcerate their way out of the drug problem. The US, by the way, has the biggest prison population in the world. The federal prison population, about half are held there for drug offences, and at the state level, in state prisons, of course, you also have a high percentage there as well. Now, given this backdrop and the growing voices of dissent from the status quo, there was a genuine hope that the UNGAS would not simply be a reaffirmation of it, and would instead be the wide-ranging and open debate that UN Secretary General Ban Ki-moon called for in 2011. And I think you have to let me know if I'm running out of time, so that I will wrap up. Okay. So we look at the next slide. I'm presenting this from IDPC's perspective, and we have policy principles that we abide by. So I'm just presenting to you our assessment of how we think the UNGAS outcomes were. And I'm going to do it I'm going to present to you what our advocacy asks were in the lead up to UNGAS. So you see here, we released this publication, and we called for, firstly, an open and inclusive debate that would include civil society, of course, affected populations, but also the range of UN agencies and government agencies that are engaged with drugs. So not just the law enforcement ones, but also those who look at drugs from a development perspective, and definitely from a health perspective. We called for the objectives of drug policies and their indicators to be reset. So that the objectives of drug policy is not just about reducing supply and demand, it's about reducing the harms relating to those markets. Thirdly, we called for policy experimentation and innovation to be supported, including covering those relating to cannabis that we just mentioned. Fourthly, we called for an end to the criminalization of the most affected populations. It's definitely people who use drugs, but also people who cultivate or engage in other parts of the drug market for subsistence, that is for survival, for just to be able to survive. And lastly, we called for a commitment to a harm reduction approach. Now, given the limitations in time, I'm just going to focus on a few. So, next slide. So, in terms of harm reduction, we see. Sorry, I'm just losing my notes here. I'm just going to go with the slide. So in terms of harm reduction, we see that this term was adopted in UN language in the 2001 Political Declaration on HIV/AIDS. But this agreement wasn't made to include this in the UNGAS agreed outcome document. A really positive development was that HIV-specific harm reduction interventions were named in particular OST, that's opioid substitution therapy, and needle syringe programs for people who inject drugs. The next slide, we see in terms of decriminalization. Now, over and again, we see evidence that for harm reduction interventions to work, for health-related interventions to work, for people to want to come forward to access them, we need to take away criminalization and punishment for drug use, as well as for possession of drugs for personal use. So when we called for, so we're calling, one of our main advocacy platforms is to call for the decriminalization of drug use. And this was a recommendation that was echoed by quite a number of member states. We saw 22 countries that spoke in favor, but you also saw, of course, a smaller group of countries that specifically spoke against decriminalization. And I think it's important to point out that there are two global authorities on drug control, the UNODC and the International Narcotics Control Board. They monitor the implementation of the treaties, and the INCB made it really clear since last year that governments are not required to criminalize or to punish people for using drugs, nor for being in possession of using drugs. They're not obliged to do that, and INCB has been encouraging governments to take a health approach to this. And lastly, in terms of supporting next, in terms of supporting innovative policies, there was no acknowledgement. There was no acknowledgement of the reforms that are taking place in a number of countries in relation to cannabis regulation, which are in clear violation of the treaties. And there was a number of countries mentioned it in their statements, and a few actually even supported the idea of legal regulation of drugs, but even more countries spoke against it at the UNGAS. Next, in terms of resetting the metrics, the outcome document does unfortunately reaffirm as one of its goals to achieve a society free of drug abuse. So we moved from 1998, a drug-free world, to 2016, wanting to achieve a society free of drug abuse. Just a slight change, but nevertheless an unrealistic goal. We did see some progress in terms of moving out from just focusing on reducing the use and the supply of drugs. So they've spread out in the UNGAS outcome document to zero in more on cross-cutting issues, on human rights issues, and on women and youth-specific issues. So we saw that as a positive. And we saw actually one of probably the biggest signs of progress was the increased priority that was given to ensuring access to essential medicines. That is, for countries to make sure that even while they run their drug policies, that even when they insist on punishment for a range of activities, that they must protect the access to essential medicines. And lastly, did we see an open and inclusive debate at the UN? There were a lot of restrictions in terms of civil society engagement at the actual forum and in the lead up to it as well. It was also difficult that a lot of the negotiations for the outcome document was based exclusively in Vienna. And this meant that governments that had no representation, that was around 70 governments that didn't have representation in Vienna, found it really difficult or not possible to engage in those negotiations on the outcome document. We thought something that was really great, there's an UNGAS 2016 official website, and they had posted up there all the submissions that are made from civil society and various UN agencies and governments, and then there were some really excellent submissions from the UN Human Rights Agencies and the World Health Organization, for example. But it was disappointing that those submissions didn't seem to be really considered and incorporated in the outcome document. In the end, we thought that the outcome document, it was not the progressive change that we hoped to see, but there were improvements. And I think more importantly, that we've seen, it shows the shifts, it shows it showed clear fractures and breakdowns in the consensus amongst member states on having a prohibitionist approach or the approach that we see in the current treaties. And I think I didn't mention the death penalty, but that was something that was the clear indicator that you saw in the UNGAS debates, where that was a huge issue that divided member states at the UNGAS. So next slide, I'm just showing them just a slide from the 1998 UNGAS, just to show that despite the limitations in what was achieved in the UNGAS this year, we still see it as representing significant improvements from the previous UNGAS. And looking forward, we see the influence of the Sustainable Development Goals, and that helps us to see the need to approach drug-related problems from multiple perspectives, looking at the roots of drug-related problems and addressing the negative consequences, and particularly in relation to poverty, definitely health, and definitely gender-specific issues. And I think I just wanted to end on a more positive note, and going back into the region again, and then just saying, for Thailand, for example, the Minister of Justice this year, he went to UNGAS, and when he came back, he said, why do we still have the death penalty? Thailand still has the death penalty. They haven't executed anyone since 2009. I don't know if you can call that yet a de facto moratorium. Of course, there's always a risk that it will go back, but he did question that. Why do we still have the death penalty for drug offences? Why do we still have this overwhelmingly punitive approach to drug-related problems, in particular people who use drugs? So there are proposals to the drug law that are being considered now in Thailand and in the government. At the moment, the amendments that we see, they don't actually, they haven't yet, they're not removing criminalisation and incarceration for drug use or possession for personal use. They're not removing the requirements for rehabilitation in compulsory detention centres. But the Minister of Justice was very supportive of changing that. So we're hoping that this is very much still a live debate in Thailand, and that they will push through to significant reforms. And lastly, we sent through some reports. I don't know if they managed to reach you. We did not yet. It's a public health approach to drug use in Asia. And here we wanted to document some good practices where countries, particularly in this region, even if they're not ready to decriminalize, to remove criminal penalties, we encourage approaches. And we already see positive practices in the region that are trying to divert people who are caught using drugs away from prison, away from compulsory detention, and towards effective health and humane harm reduction services. And I have to emphasize once again, because I'm worried that I didn't say it, is that the UN has said over and over again that the majority of people who use drugs do so with no problem. They don't hurt anyone, they're not even hurting themselves. And only about 10% or 11% of people who use drugs might have some problem with it. So when we're developing treatment and rehabilitation approaches, it's really important to bear that in mind and not to waste our resources, not to waste the lives, destroy the lives of other people further by forcing them into treatment and rehab. And I just wanted to end there. Thank you.